5-month-old male child was brought to us with complaints of abdominal distension and constipation since birth. This abdominal distension used to occur once the child would not pass stool for 5 to 7 days and would always require a suppository according to parents to pass the stool. So at the age of 5 months, he was brought to us with the similar complaints. At the time of admission, we could see that abdomen was distended and all the bowel loops are quite prominent. An X-ray abdomen was done, which showed dilated large bowel with gas, and there were air fluid levels also visible. So keeping a strong possibility of Hirschsprung disease, we plan to go ahead with anorectal manometry, which is the best screening method to rule out Hirschsprung disease. So in anorectal manometry, we usually see the anal canal or the sphincter as a band of a high pressure zone. So as I already told you, the color coding, so anything which is blue is less pressure, and this is something more than that. So this is the high pressure zone we are seeing. This is contributed by both internal anal sphincter as well as external anal sphincter. So whenever we inflate a balloon, normally there has to be a relaxation of the internal anal sphincter. In our patient, nothing happened in spite of inflating the balloon to the maximum capacity allowed for this age group. So this patient was diagnosed as Hirschsprung disease, but for confirmation, we required a full thickness rectal biopsy. Just to understand the various parameters, what we look for in anorectal manometry, this is the resting anal pressure, as I already discussed, contributed by both internal anal sphincter as well as external anal sphincter. This is what we see when the patient is asked to squeeze. There is a high pressure zone. Most important thing in most of the patient is rare, that is recto-anal inhibitory reflex, which is a normal reflex present in people. Whenever we inflate the balloon, we saw a fall in the pressure zone. So this is normal. When it is absent, this suggests that it can be Hirschsprung disease. Other things what we see is look for is the first sensation as well as balloon expulsion test to rule out the dyssynergia. Now this child, 2-year-old male, again he came with constipation for 3 months, since 3 months of age, which had not responding to laxatives. Now we can see that the barium enema was done on this child, and we can see a transitional zone on this child. So looking at this barium, a possibility of Hirschsprung disease was kept. Now we need to understand that if it is functional constipation, we will usually see the dilated bowel and till the end. So there is usually no transitional zone, but in our patient, we could see that there was a small transitional zone in this. So a Hirschsprung disease possibility was kept and child was sent for surgery. However, we wanted to be double sure before proceeding for surgery. We did a anorectal manometry, and this is the normal band. And as soon as we inflated the balloon, we could find a beautiful rare present in our patient, which actually ruled out Hirschsprung disease. And once we find such, there is no need to go for any biopsy to confirm it. So this ruled out Hirschsprung disease on our child. So the take-home message is anorectal manometry is the best method to rule out Hirschsprung disease. Gold standard for diagnosis of Hirschsprung disease is suction biopsy from the rectum.